Following a hysterectomy, following recuperation from surgery, certainly not before 6, 8, 10 weeks following the day of surgery, but after, it's really important for women to have an investigation of just how their hormones have been affected, if at all, by their hysterectomy. Many women have a hysterectomy, do not have their ovaries removed, and have no hormonal consequences, but many do. And unless your hormones are investigated following hysterectomy, will not know. So by the 3rd month after an uncomplicated hysterectomy, even with the ovaries left inside, we should have a clear investigation of what that woman's hormones are doing or not doing, and whether or not she needs supplemental hormones to bring her back to the hormone levels that she started with before surgery. Sometimes a woman has to have her ovaries removed at the time of surgery, or they are removed because they're thought not to be functioning, or they're removed by mistake. Under any of those circumstances, a woman's hormones become the same as a 90-year-old woman or a pre-pubertal child. In either case, she needs dramatic and emphatically needs replacement of her hormone therapy. Absence of the ovaries at hysterectomy or removal of the ovaries during hysterectomy is associated with a large number of very severe health consequences. They include the early onset of Alzheimer's and dementia, the early onset of heart attacks and strokes, the early onset of Parkinson's disease, and premature death. Hard not to take those consequences very seriously. And for women who have had their ovaries removed, not only do they need estrogen, but they may also need testosterone for normal sexual function, normal energy, sense of well-being, muscle strength, etc., etc. Those women need special attention compared to those women who have an uncomplicated, simple hysterectomy where their ovaries are left in. The estrogen window is that time following menopause, early in the menopause, when a woman can actually benefit from hormone therapy. When I say benefit, I talk about benefit in the primary prevention of diseases that ultimately she will get without those hormones. Those include prevention of osteoporosis, perhaps dementia, cognitive and other dysfunctions, mood, sex, and even heart disease. So that window provides a short time, perhaps 6 years, perhaps 10, when a woman can use hormone therapy for prevention of those diseases, ultimately reducing her risk of all causes of death. It's a very important time in a woman's life that once it's exceeded, once the window is closed, can't be opened again.